Okay.
Thanks.
So welcome. Good evening, everyone, to the Rotary E-Club of District 7710, and I'll pass it over to Kathy.
Thanks, Jeanne. I'm very pleased to introduce Dr. Sonya Patel-Nguyen this evening to the Rotary E-Club of District 7710 as our guest speaker. Sonya was born in the greater Raleigh area, and she attended the North Carolina State University. She majored in biomedical engineering with a minor in social work. During college, she explored global health topics in engineering and public health, traveling to Costa Rica, El Salvador, and Ethiopia. She attended UNC Medical School, during which time she took time off to pursue research and nonprofit work with the Palestinian Cleft Society in the West Bank. She graduated medical school as an inaugural member of the UNC Gold Humanism Honor Society, with awards honoring her dedication to health, humanism, and human rights. Sonya has continued to pursue global health topics and electives during her residency. She's traveled to South India as a Sanders Scholar with Project Hope, and has volunteered with the Syrian American Medical Society, providing primary care to Syrian and Iraqi asylum seekers in Greece and Jordan. Sonya plans to pursue inpatient medicine, critical care, and global health in the future. Please join me in welcoming Sonya to the meeting this evening. Sonya?
Hello, everybody. Now you can hear me.
Hi, Sonya.
Thanks for having me here today. I know that you guys the month is on maternal and child health, so I'll try to pull some snippets of that into this talk. But basically, I just kind of want to talk mostly about my experience this past year volunteering in Greece and Jordan. I spent about a month there back in September and another month in January in both of those locations, and was able to kind of experience kind of the whole gamut of setting up a primary care space in refugee camps, providing that care, and also seeing what happens when the camps are dismantled and people are spread out outside of the camps, and going through the issues that come along with that in terms of providing care to those people. And so I'll try to have a little bit of a focus on maternal and child health issues in that setting, but feel free to interrupt at any time. I don't want it to be too formal, and then hopefully there's plenty of time for questions at the end as well. So let's see, this thing of course is always really slow for me. There we go. So just a couple words quickly about the crisis at hand. And I know that everyone kind of already knows everything that's going on, but in terms of who refugees are and what exactly their definition is, because I think that we use the word refugee to mean many different things, especially in the media, when really there are different terms. But the 1940 Universal Declaration of Human Rights came about at the end of World War II, and really set forth this idea that people had the right to certain things, and that right included fleeing persecution, finding asylum in other countries, and also the right to seek health care and be provided health care to some degree. There are debates about how that health care should be provided, but it was a general right established during that time. And then in 1951, the Refugee Convention occurred, and mainly was meant to focus on refugees coming out of Europe. But then in 1967, around the time when there was a larger Palestinian surge of refugees, that convention was expanded to talk about all refugees and not just those coming from Europe. And really what it did was define refugees as people that were fleeing persecution or finding safe haven, and also established the UNHCR, which is the UN High Commissioner for Refugees, which has become kind of this governing body for refugees and asylum seekers in various places throughout the world, but mostly in the Middle East and now also in Europe, as well as in African nations. So this was probably about 6 months ago, the demographics of refugees, and there are 65.3 million forcibly displaced people. 21 million of them are actually registered refugees, and 16 million of those are registered under the UNHCR mandate. The other 5 million are actually Palestinian refugees since 1948, and they're registered in a subset department, the UN Relief and Work Agency, because they are they were, up until the Syrian crisis, one of the largest refugee populations in the world. About half of those 21 million are children under the age of 18, so there's a huge need for children. About 10 million of those are stateless people who either came from countries that no longer exist or were denied nationality, didn't have papers, all of those things, which makes it really hard for them to get from one place to another, even getting back to where they came from. Now, most of the world's population, the displaced people are being housed in the Middle East and North Africa. That's where the largest burden is. There is a burden in Europe now. It's around 6%, which wasn't previously that way. But you can see in that middle graphic that half the world's refugees come from only 3 countries, and that's Somalia, Afghanistan, and at this point now Syria. Over 5 million people, I think, to date now. This other graphic on the side here shows the top hosting countries, and you'll notice that Turkey has 2.5 million people. By comparison, in this map, Greece doesn't even show up, but Greece has about 60,000 refugees coming to its border, and Italy is probably approaching that number in the next year or so. There are also tons of refugees in Jordan and Lebanon and Iran. So the Middle East is bearing the brunt of a lot of these refugees, again, probably because they're coming from the Middle East, but then also being displaced in other Middle Eastern countries. And you can see where that would cause a lot of issues in general. This is just a map of kind of the routes that people are taking in Europe. So most of the people that I met in Greece were coming directly from Turkey. They had caught boats, as many of us have seen kind of on the news. There are also people coming from northern Egypt as well. And then now that Greece has Greece and Turkey have both kind of come under this EU agreement and try to stave off more people from moving to Greece, there's been an increased migration in the past 6 months or so to Italy, coming from places like Libya. Spain is seeing some Moroccans, but there are also Moroccans that have actually traveled all the way across Africa up into Turkey and then to Greece as well. A quick note about the refugees that I was mainly seeing. So Syrians, Iraqis, and Afghanis were the majority of the refugees or asylum seekers, and the Pakistanis and Moroccans that were in Greece were mostly migrants who were coming for economic relief after the whole first big wave occurred in around 2015. A lot of people, there were some religious differences, but most of them, the majority of them, are Muslim from any sect. And there are a lot of kind of ethnic and regional differences, tribal differences that sometimes cause conflict within the populations themselves. But on the outside, when it comes to where you're fleeing to, Greece and all these other places, everyone kind of seemed very similar. The timeline for movement, most people, again, that I was seeing in Greece came from Turkey initially, and they had set up these illegal camps. You may remember Idomeni, which was a campsite that was a bunch of kind of tents like this blue one you see at the bottom of the screen, along railroad tracks, lots of issues with police and violence. And eventually the UNHCR, which is that governing body, set up these official quote unquote camps. So this camp that you see here is Camp Petra, and it's an official UNHCR camp. You can see that there's, these UN kind of tags everywhere. So this is something that's sanctioned. It's supposed to be the best you can get in terms of refugee camp, which is, as you can see, kind of sad. A lot of these official camps were actually separated. People were separated by region or ethnicity or religion. So this particular camp housed the Yazidi population, which is a special religious and ethnic group, Kurdish group out of mostly Iraq and partly Syria and Turkey as well. And so they have their own issues with persecution from ISIS and from other groups, and underwent a mass genocide in 2014, and that's where most of these people have come from. So I was seeing them in 2016, 2 years after they had initially fled, many of them to Turkey, and then about a year ago from Turkey to Greece. So again, people are usually separated by what region they come from and that type of thing, mostly for their own safety and also because it's easier and they keep families together. As I mentioned, I was at Petra. Let's see if this next slide will come up. This thing tends to be so slow. There we go. So Petra Camp was actually set up in a place called Petra near Mount Olympus in Greece. And it was actually an abandoned psych hospital. So there was this kind of dilapidated structure that they set camps up in, and it housed about 1,200 people. They were all Yazidis, 95% of them were Iraqi, and over half of them were children. And that's actually under the age of 15. This just gives you an idea. whenever you have an official refugee camp, you have to note how much water there is, how many toilets, showers, all of those things should be proportionate to the number of people that are there. So there was availability of running water coming from these kind of side faucets from the ground. And then toilets, there were porta-johns, and then showers were really like these little huts. There was food and clothing distribution. Lots of different NGOs are assigned to the camps and to provide different aspects of care. The UNHCR doesn't do that on their own. So again, my role as a physician was really providing primary care, and as someone who's both an internist and a pediatrician, my skills fortunately came in handy in many different areas. This is a look at the outside of that abandoned hospital that we turned into a clinic, and you can see people, waiting in line right here, these lovely ladies waiting to come in. These blue books they're holding are actually the medical records that we set up for them so that they could bring it and we could know what happened even after we left, or if they went somewhere else. This was kind of our waiting area. And when I went here in September, this didn't exist. This clinic didn't exist. So we pretty much set it up from the get-go, the whole flow and everything. We were kind of proud of ourselves by the end of that. This was a great clinic space that we created. We bought a bunch of shower curtains, put them on beds, hung them up, just to create more clinic spaces because we were seeing up to about 80 patients a day. And with that kind of volume, we really needed separate space. So communication was kind of a unique issue, and we used translators. This particular group of people spoke Kurdish. Many people spoke Arabic in other camps, but Yazidis are Kurds, and so they speak mostly Kurdish. These lovely people here are all essentially children, age range is 16 to 21, and they didn't speak a lot of English when we met them, but they really wanted to learn. They signed up to be our translators, and we used a lot of Google translating apps to help figure things out from English to Arabic to Kurdish and backwards. So it was a really interesting experience, but they were very highly motivated people and really impressive. One of the girls, Khawla, I remember said this to me, that when I started 3 weeks ago, I only knew stomach and pain in English. And by the end of it, she could say, are you having burning urination? And are you having chest tightness or squeezing? I mean, it was remarkable how much they actually learned by the end of it. So we did have some treatment options, and we kind of operated like I would say a rural clinic with kind of the need to do regular primary care, preventative care, and also some sort of minor procedures. So we did have a formulary of medicines available. In Greece, it is illegal to import medications, so we had to purchase everything from the Greek formulary, which did limit us to some degree, especially coming from here or other physicians that came from Europe who are used to a wide variety of medications. You really had to stick to one or two things that you knew because those were the only things on formulary. Every now and then you could do special orders, but it took a lot of work. We tried to get TB medications for one patient and took probably about 3 weeks to get it all the way through the Ministry of Health. There's always issues with differences in European and medical guidelines, but I learned a lot. So at the end of the day, it's all pretty much the same. Lifestyle changes is one of those things that as doctors, we really like to prescribe a lifestyle change, getting up and exercising, improving your diet, washing your hands. All of these things are things that we would tell our patients here, but it is nearly impossible to tell people there. If you can see this, this is people's clothes hanging outside. It just rained, so they got wet again. It's muddy. I mean, there are a lot of things that really limit how much you can do here that's not medical. And then, of course, your medications are limited. So it really is hard when someone comes in with a stuffy nose and you can't tell them to do a humidifier. You have to improvise. And so we told people to boil water on the pot, sit over it with a towel. For hand hygiene, we said, kind of do the best you can. Water running over your hands is better than no water running over your hands. Close living quarters did make the spread of infection very easy. Lots of respiratory illnesses, flu-like symptoms, gastroenteritis was also an issue, and that played an even bigger role when you had contaminated water supplies, which did happen in some of the camps that we worked in. Again, you saw this camp was an open air camp. So some of the other camps, and I'll show you pictures later, were tents that were actually set up in a warehouse setting. And those people didn't have, they could at least escape the rain. But the folks at the Petra camp often had flooding in their tents, unfortunately. They did what they could, though. These are tomato plants actually growing out of what looks like concrete right next to a tent, which I was always very impressed by. So they did what they could to kind of make it their own. This is an example of the stoves that they set up and how they would boil water and kind of cook some of their food rations. You can see here that they had these cots inside of their tents, and most families, because they were big, had 1 or 2 tents, or 2 or 3 rather, and not just 1, so that was really helpful. This is one of those camps that was inside of a warehouse, so at least these people are protected from the elements. In the winter, it was more difficult because they were piping some heat in there, but there wasn't a lot of heat, and you can't run a fire on the inside of the warehouse, so that was definitely a huge problem. And then I'll talk about access to specialists. There really isn't any. I mean, we did referrals to some specialists, but wait times could be 6 months to a year, which really didn't make a whole lot of sense. Volunteer physicians came through our organization. Generalists were really appreciated, but specialists would often come, and we would do like an OBGYN week where we scanned all the pregnant ladies or took care of all the GYN complaints. We would have a cardiologist that would come and do echoes on everyone if we made a list of, you know, who needed them ahead of time. So that can be helpful, but again, it's fragmented care. It's not ideal, but in a setting where people are mobile, it's actually an okay plan. It's not something you'd want to do in a permanent setting, of course. But it worked in this instance as best it could. Excuse me. This was just to show that the problems we have here, where people come and demand medications, we had there too. People would come in demanding all sorts of things, and we didn't always have it, so not everybody was a happy customer. We did do some minor procedures, and most of that happened to be on children. So a lot of kids, especially in the summertime, there were a lot of infected wound bites. Mosquitoes, spiders, all sorts of things that were in the camps. They would bite people and they would become super infected, and you would have abscesses and things like that, overlying skin infections. Bed bugs were a big issue, and so were scabies and lice, and it was really hard to usually hear you tell people, you know, wash your clothes in hot water, dry it all. It's hard to do that when you're there. You know, you're hand washing pretty much everything. You have to hang it outside to dry. It takes time. You still have to sleep that night. So people were just constantly becoming reinfected no matter how much we were treating them. We did have lacerations. This was a kid that I saw on one of my first days out there who fell and had to get stitched up. And it was really nice if we could do that stitching in-house rather than send them to a hospital, because their hospitals were very taxed in general, and in Greece with their own kind of economic crisis, their healthcare system was really not equipped to deal with this influx of people. This was a kid that I saw in Jordan in one of the longest standing camps that's been there for 5 years, and he just didn't even have shoes to walk on. So this is what his poor feet looked like. And again, I mean, you can't prescribe shoes, and even if you could, they're limited. So this was just another one of those kind of heartbreaking instances. This little girl fell backwards and had a big cut on the back of her head. Here, I might staple that kind of cut, but there I didn't have those equipment. So really, I just let it heal on its own, because the scar really isn't a huge deal when it's on your scalp. But she was very stoic about the whole thing, and we all kept commenting, you know, look how strong you are. And her dad said this, said she's Iraqi and she has seen more blood. She has suffered pain much worse than this. And I probably heard that once or twice a week from different parents, which it was really was heartbreaking. Mental health issues were definitely abound. So lots of depression, panic disorders, conversion disorders among women, especially women that would have fainting spells just from stress. Lots of kids had behavioral issues and enuresis, which is bedwetting, which usually goes away at a young age, but can come back when you have lots of stress in your life. And as you can imagine, I mean, these people have been through so much, lots of nightmares, night terrors, coming from the memories that they had from back then. And from having, you know, knowledge of loved ones being killed and that kind of thing. A lot of the kids in this Yazidi camp were part of the genocide that occurred, and actually saw people being executed during their time there. Sometimes they take it out on you, and so one of our translators very astutely said to me, you know, don't blame him, it's because of what he suffered. And I think remembering that here and abroad when you're in refugee situations like this is always really important, because it never is personal. Substance abuse was also an issue that I wasn't quite sure I would have encountered, but alcohol use was actually fairly common, despite it being not something that Muslims generally do. We did have some people throughout the camps that were alcoholics that drank way too much. tobacco use, you couldn't even counsel people really not to use cigarettes because it's what they did to pass the time. And then paracetamol, which is Tylenol, overdoses were actually not common, but was seen sometimes from young women who were making suicide gestures. So we had to limit really how much of that we could give out. Of course, people said about the smoking, you know, if I wasn't sad all the time, I wouldn't smoke. So just let me do this. And if that was the one refuge they had, you know, it's kind of hard to let them smoke as a physician, but there were bigger battles really to fight. So to focus on pregnancy and newborn care, there was actually decent pregnancy care in the area because hospitals really did try to come and take care of these women. So a lot of them would have clinic appointments once a month at the hospitals. There were also NGOs that had mobile vans with ultrasound and things like that would come around once a week and help care for pregnant women and also women that just had GYN complaints or might need an ultrasound in general. One of the hardest things I found was when a newborn was born, then they were discharged home, quote unquote, 2 days later, and that home was in the refugee camp. So I often had 2-day-olds that came to me for kind of newborn checks, which is a little terrifying, and then they go and they stay in their tent. So that made, you know, that was just difficult in general. And then there's also this false belief occasionally that locally born children actually have citizenship or can stay in Greece or are more likely to stay or get sent somewhere, and that just was unfortunately untrue. But lots of babies in camp. We did have a 16-year-old who we told her she was pregnant after she came to us with some kind of vague abdominal complaints. And she said, you know, no, there's no way I can be pregnant. You know, I'm not married. And then she came back the next day and she said, of course I'm pregnant and now I'm married. So things like this happened in the camp, and sexual assault was not, I wouldn't say rampant, but did occur. I probably wouldn't know how much it occurred because it was very underreported, and whether or not this was a similar case, it's hard to say now that everybody was on board. But it did happen for sure. This is a group of kids that I saw in Jordan. They're Syrian, and their poor mother actually died in Syria, and their dad died after they had moved to Jordan. So there are situations where you have orphans and they become part of an orphanage, and then their asylum applications don't really get pushed forward. There are plenty of people who didn't want to be pregnant, and unfortunately we didn't have great birth control options other than the pill. We always thought that having a depot clinic was a great idea, where you go and you inject everyone and they can be protected for 3 months from pregnancy, or IUDs, which can protect for even longer and is actually pretty common in the Middle East. But that would take, you know, a little bit more of an effort on OBGYN's part really to be able to do that. This is a little kid who had bronchiolitis, and we had an asthma inhaler and we used a paper cup to help deliver it. So a lot of innovation happens when you're there. This dad was very frustrated in general, and we're lucky that this guy helping him was a retired pediatric lung doctor, so the best specialist you could have. But people often felt like something's wrong and no one will help me. And so that was kind of a constant battle that we were fighting. We had other infectious disease outbreaks. So this was a chickenpox outbreak that we had in one of our camps back in January, and this poor kid had it. Those things are reportable. This is just because it's fun to stick your tongue out at little kids and they'll stick it back out at you. So this was in Jordan and just during a routine checkup. There were some preventative care things that we did. So there were vaccine campaigns that were basically headed through the Ministry of Health in Greece and also in Jordan. So flu vaccines and MMR vaccines were the mainstay because we wanted kids to be able to go to school. And to be able to go to school, they had to get their MMR. And families were actually really reciprocated. They really wanted vaccines, actually. They would ask us for vaccines. The problem was if people like MSF or Doctors Without Borders would come in and do one round of vaccines and not do follow-up. And so, you know, many of these vaccines, you have to have multiple doses over a certain period of time to really have an effect, and people weren't really getting that. A lot of dental care. I had a box of dental varnish that I put on every kid I saw because nobody brushed their teeth and they all had rotting teeth. That was probably one of the biggest unmet needs of children out there, was dental issues, and I would say eye issues as well. Those specialists were just lacking. And a lot of these kids really needed, first, better hygiene, but a lot of them needed their teeth pulled just because of decay and other things like that. And then lastly, emergency situations. So this is the road to the Camp Petra that I showed you guys, the open air camp. And there were 2 ambulances in the nearest town, which was about 45 minutes away. And they often refused to come up the mountain because of that drive. saying, you know, one of our ambulances is occupied, what if we need the other one? Which is kind of a sad statement because we did need the other one. So there were times where we had children, we had one kid that was so sick and really needed to go to a hospital, and they refused to come. So two of our doctors started an IV, hung fluids that we actually had with us, and then drove him down the mountain themselves to meet the ambulance halfway. And that kind of thing was unfortunately pretty common for this camp, and really left kind of a bad taste in my mouth, and also a lot of distrust among the people that lived in the camp. There was one girl that unfortunately died a couple weeks after being in the hospital. She was 3 years old, and she had a very, very rare illness that she might have died from even if she were here, because it requires very advanced medications, chemo drugs, that kind of thing. But the only thing that the people in the camp remembered was that the ambulance wouldn't come for her. And no matter how much I told them, you know, she probably would have died if she were here as well, getting the best care in the world. You know, they won't know that. All they'll know is that they think that people have abandoned them. So in terms of what's next for most of these people, this is a camp that I went to in January. You can see it feels very lived in, much more so than when I went and saw them the first time, where they've set up their own little breakfast nook outside of their camp. But a lot of people were moving out of these warehouses and into hotels and apartments and like old complexes, like summer towns that weren't being occupied in the winter. And that was mostly because these were not winterized places, these warehouses. They're moving them into warmer environments. For the most part, they were better environments, but sometimes they really were not. They didn't have running water. The issue too, though, with moving people out is that the ability to get services to them was much more difficult. So if you had a bunch of people living in a hotel, maybe it was easy, but if they were spread out in different places, it was hard to get them health care, difficult to get their food rations, difficult to have one place where they could come to do all their paperwork to move on to the next step. At this point, it feels like most people that are in Greece might actually end up staying in Greece. And so I'll be curious to see how that pans out. There were some people that were getting the okay or getting acceptance to move to places like Germany, Ireland, Belgium. Some people went to France, but it was very rare. And the overall feeling is that people will end up staying in Greece. Just briefly, my lessons learned are really that people are people are people. They are appreciative of any little thing that you can give them, but it's sad at the same time that they kind of have to resort to the generosity of others. A lot of these people had money, they had things, they had jobs, they had, you know, a life before they had to leave, and now they are living in camps on the side of a mountain and relying on the goodness of strangers. So it's a very kind of humbling experience to be among them. I think everybody has a role to play, and we can all do something. And for me, that was going, learning, serving, and then telling others about it. And I think that all of us with our unique, you know, attributes and things that we do can do something for these people. These are some of our translators who were refugees in the camp, and they, with their food rations, made us a glorious meal one day. And they cleared out this little plot of land near their tent, and, you know, put out some of these mats, and we ate the best they could do to make a traditional Iraqi meal. So really generous people, just some of the nicest people in the world. They did the same on our last day. This is us in their tent. You can see their beds are on the side over here, and they kind of clear out space, and we're eating with them. The kids are great. This guy is one of the brothers of one of our translators, and he loves to dance. So this little schoolhouse they had set up in the middle of the camp, he used in the evenings for dance classes, which was really, really fun. And they did all sorts of stuff. They danced Bollywood, they danced hip hop, a lot of Michael Jackson, they love him. So really great to watch because kids kind of need some reprieve. This is just us again. It's a great group of people that I worked with. Always a good jumping picture. And then this is the group that I worked with, the Syrian American Medical Society. They do lots of work, and a great group that I'm hoping to go and volunteer with again. And this is one of the last things that one of our volunteers said to me when I saw him in September. Unfortunately, I got to see him again in January, which was really a nice surprise, but it kind of makes everything that you do worth it when people, you know, you don't do it for the acknowledgement, but at the same time, it's nice to know that what you're doing is actually making somewhat of a difference. And with that, I leave you. That's my dog. I'm really sorry. But I'm happy to take any questions.
Thank you, Sonya. Okay, so we'll open it up to questions. So if you want to unmute yourself, feel free to ask any questions. Go ahead, Kathy, do you have a question?
I do. Sonya, it was just so moving. And the thing that amazes me is that, and you hit on it, is people are so appreciative of things that you do. And in the pictures it comes through, they're smiling even though their situation is very dire. What is the average amount of time that a person or family is in the camp?
So it depends. A lot of those people were in camps. They were in Greece since April of last year is when most of them arrived. And they had been moved into those camps probably in about July, and they were still there in January. Many of them were being moved out by January. And the idea was that actually there's many people on the islands near Turkey, Lesbos, and some of the other places you may have heard of that are still completely full of refugees. And the plans, I think, are to move those people from the islands into these warehouses that were previously inhabited. So these guys probably spent at least 6-7 months in these camps, but it really does vary depending on where you're at.
Which is a very long time when it's a very long time.
It feels like years.
Yeah, great question. Great presentation. I had 2 questions for you.
Sure.
The first question is, how did you make those people to be confident with you so that they could work with you positively and not view you as a visitor or just somebody there who is there temporarily and then you leave them? Then question number 2 is, where did you live when you were there? Where did you?
Yeah, so there was definitely a little bit of that heartache of people come and then we become friends and then they leave. And I think I felt that way myself, and that's what prompted me to go back in January. And it was really nice to reconnect with those same people because it felt like, you know, I hadn't forgotten them and they felt like I hadn't forgotten them, which was nice. But I know that not everybody can do that. There is, I think initially with translators and with patients, there's always this kind of just sense of gratitude that people are working with them. But towards the end, when they've been there a long time and they've gone through doctor after doctor and it's a new face every week, it becomes more frustrating. And a lot of them say, well, I just said this to someone last week and it may not be documented as they wanted in their book. And that became a problem. So the organization that I worked with actually started putting a limit, or a minimum rather, on how long you had to be there to volunteer if you were a physician provider. It was 2 weeks, and it was 1 week, then it was 2 weeks. Now it's actually 4 weeks for that very reason, just to give some sort of continuity of care. The translators, you know, their confidence, they had no confidence when they first started, but they were very eager. And there are some people there that are just so eager because they think that it will help them move to the next step and start their next life in a different place. Many of them hoping to go to English-speaking countries like Canada or the US. That is less likely to happen if you're already in Greece. People that are moving here are coming mostly from Jordan or Lebanon camps because they've been there a lot longer, 5 years or so. So a hard situation to navigate, but one that, you know, got better, I think, with time. And then as far as where we stayed, we're not allowed to stay in the camps. And so we mostly stayed in apartment housing or hostels or hotels that we paid for on our own.
Hey, Sonya, this is Eve. Great presentation. I really enjoyed it. So I had a question about just the basic logistics. I think in terms of tracking medical records, I saw those blue folders. And so how much information is printed and passed off to them versus what's kept in a database? Like, is there, what kind, just to allow for continuity? Because I'm sure it's really hard to, with rain and wet and just trying to keep documents safe.
It is really, that was probably one of the most challenging things, and it changed over the time that I had gone there. So those blue books were something that we did as an organization and we gave to patients, and it allowed them to keep a medical passport, which is something that is done in a lot of African nations and some Middle Eastern nations as well, as a way to keep records. It worked pretty well for the most part. Some people lost books, but those were the people that didn't really come very often anyway and didn't have a lot of chronic issues. but it did help for people that had chronic issues, where you could kind of see what had been done, what kind of meds they were on. By the second time that I went there, they were actually starting to do a little bit of online or database stuff on the computer, but most of that was for tracking data collection so that donors could be informed about the kind of work we were doing to a greater degree. Prior to that, we were using Excel sheets, which is not a secure software. And so this second software is one that I think the WHO puts out for free for NGOs to be able to use in situations like this to help track patients to some degree. And it's not a great tool in terms of like a medical record because you can look at past visits, but it's just not built for that. So it's mostly meant for tracking things like infectious disease or how much medications we're using or what kind, so we know how much we need in the future and that kind of thing.
Thank you.
Mm-hmm.
So how did this experience change your life?
Yeah, that's a loaded question. You know, I've done a lot of different travel experiences that are health related in different ways. This was probably one of the first times career-wise that I felt the most useful in terms of my clinical abilities and ability to provide care. I can't really explain how it changed my life, but I know that it did. And I know that refugee populations and immigrant populations are ones that I am most interested in working with in the future, not just abroad, but also locally. And so that's something I've started to delve into here as well, with people that have been assigned to our area or relocated to our area through the local organizations, and helping to meet their needs. There's something very special about, I think, this population too, for me, in that just what they've gone through and how long they've gone through it, and kind of the ongoing political ramifications and social issues that they face in our country, especially in the last year or so, and how they're viewed has really kind of tugged at my heartstrings and is, I think, prompted me to be a better activist rather than someone who kind of passively does what sort of needs to be done.
Thank you, Sonya. Are there any other questions? Well, I think we have time for another 1 or 2 questions. Eve or Sharon?
I mean, I want to ask a question. This is Shireen. I want to ask a question, but I know I can't be much help. I'm wondering how to make the time, or how you can afford to spend some time, 1 month or 2 months out someplace else that far, because I mean, I'm a general dentist and I find it very difficult to even in private practice to even take 1 week off to go to Latin America. It's just, especially considering retirement and working towards retirement, it's almost impossible for me to spend a month that far. How do you afford time-wise and financially to do that?
So fortunately for me, I'm still in my training years and I'm close to being done, but because I'm in my training years, we have what's deemed elective time. And so I have convinced my program to let me do an elective where I get to volunteer and do good work. Other people take those electives to do research at home or to sit around and do nothing, but this has been my chance to kind of go and do those things. So that has been really nice. And there have been grants for me at work that have allowed me to help pay for things like plane tickets. And so not too much of it has become out of my pocket. As I think more towards what I want my career to be, I think that plays a big role in it, because certain careers in medicine require, kind of like a dentist schedule, Monday through Friday, working in a clinic versus doing shifts in a hospital where you're working, you have a little bit more time off that's consecutive rather than just weekends. And so thinking about what I want my job to look like in the future and knowing that I want to balance it with being able to do time work like this, I think it's given me some clarity in terms of my career trajectory, because in terms of what I want to do. It has not been easy to find that time, and I spend some of my vacation time and things like that traveling as well. And I know that all of that will be harder as my family grows. But for now, I'm trying to make the best use of it as I can of that time.
Mm-hmm. Thank you. Now, do they have any dentists that volunteer?
With Sam's has done a dental, they have done some dental trips, mostly in Turkey, I believe. They've done dental work there, and that was actually spearheaded by a group of dental students at UNC in memory of the 3 Muslims that were killed a year or 2 ago now. And so they actually have gone out there with Sam's and done some dental clinics. There is always a need for more. When I was in northern Greece, I only met one dentist group, and they said that they were really the only dental group there. And they would travel to a different camp every day and essentially just pull teeth, and lots of teeth. And they were the only ones. I mean, they were much needed. So there are some, when I was with Sam's, I don't think that there was anyone that was coming to Greece and doing that kind of work, but they do have people that go to Jordan 3 or 4 times a year to do subspecialty work, and they always use dentists at that time as well.
Thank you. Thank you very much.
Yeah.
Thank you, Sonya. Eve, did you have a question?
No, I didn't have another one.
Okay, just checking in. If there's, I'll give everyone another second. If you do have a question, feel free to unmute. And while we're waiting, I did have one question. Sonya, have you ever heard of, as you were talking about OBGYN visits and reproductive health, and those, at least they were able to visit hospitals once a month. Have you ever heard of the app mAdapt?
I have not.
So, and Osborne, maybe you can chime in on this if you know anything about it, but there was a Rotary Peace Fellow who graduated last year who was starting this project at UNC for a mobile app. So, and actually that begs the question, well, first, the mobile app apparently would provide reproductive health answers in terms of information, but I guess, you know, do those, do the refugees there have access to, do they have mobile phones? Do they have phones?
I mean, you can go to like the poorest places in the world and people still have cell phones, which is kind of awesome. And a lot of people there did have smartphones. Many of them were given to them by people that had been there previously. And some of them actually brought their smartphones with them from home and still had them. They didn't have data. They didn't have, you know, a lot of phone minutes or things like that, but there was Wi-Fi instilled at all of these camps. And so you would see a lot of kids just huddled around the Wi-Fi router to be able to use that. So there would be some, people would be able to use apps and things like that.
Sure.
Yeah, I think it's still an ongoing project. The mobile, it's called mAdapt, whereby they are coming up with an mobile application to help women, especially to get information on how to improve on women's health when they're in these refugee camps.
Very cool.
Yeah, and then my last question probably is, maybe it's an unfair question to you, is why do you think most Arab League of Nations don't take in the refugees, and they leave all this burden to European countries?
I guess I would answer that, meaning which countries are you talking about? Because Jordan has about 1 million refugees from this crisis and previous crises. Lebanon has over 1 million. You know, those are the ones that are bearing the biggest brunt. And Syria previously had many Palestinian refugees. So all these countries had, you know, many hundreds of thousands of Palestinian refugees that they've been housing for decades now. And then with the Syrian crisis, Lebanon and Jordan have also had to pick up that slack. So they by far have more refugees there from Syria than Greece or Italy. I think that there are different waves in time in which people traveled. So the ones in Jordan have been there since the beginning of the war, and then Jordan closed their borders down. And then people started finding alternate routes and going towards Europe. I think that the Arab nations try to some degree, but their systems are also not always built for housing this many refugees. It's not always built for being able to care for their own population. The thing that people think now is that there are more people in Jordan that are not Jordanian than there are Jordanians because of the amount of refugees that they've taken in over the last several decades. And so I think when you're putting a lot of these people into a country where there's already a taxed economic, healthcare, system, it makes it very difficult. And they rely on the UNHCR to come in and help with this. The difference in Greece, Greece also, from many European countries in comparison, does have a huge economic burden, but they are trying to co-run this refugee crisis with the UNHCR, which is kind of uncharted territory. And I think Europe has really done Greece a disservice, the European Union has, in terms of being able to give them funding and to help expedite the process of getting these people moved to other places and to other countries. So people have been stuck in limbo in Greece and Serbia and some of these other places kind of on the eastern side of the continent. So I think it's a bit more nuanced than just saying that, Europe is carrying the brunt of all of this, because I think the Middle East has done a lot with a little, but unfortunately the scope of the issue kind of surpasses that.
Yeah, I was talking about countries like Dubai, Doha, Qatar. I mean, those are very wealthy nations, but we hear so little of their impact when it comes to this refugee resolution and
They
refugee.
are, and I don't know what to say about that, except to say that people have to be, the people that are leaving aren't wanting to go to those countries anyway. So those countries are not in the route of where they're traveling to begin with, and many of them have this desire to go to Europe or to America or to some of these other places where they might have gone for economic reasons anyway. Now, it would be nice to economically, go to Dubai or Doha or some of these other kind of richer, oil-rich countries, but it just hasn't been historically where they want to go. Europe is kind of changing the attitude in that they are putting people in countries where people never really wanted to go either, like Latvia and Bulgaria, Romania, some of these places that people never thought of going. They are accepting people into those places and helping them, set up a new life. But you're right, there are some places that should do more. But I think that there's a bit of kind of a selfishness, and then also this issue with ISIS and the whole religious but not religious aspect of it all, that is unfortunately tied to all that.
Well, excellent questions, Osborne, and thank you everyone for participating. And so Sonia, thank you again so much for being here this evening.
Thank you, guys.
Thank you.
And where is the